I'm Dr. Ken Landau. Thanks for watching. Let's talk about vitamin E. Vitamin E is a natural ingredient in some foods. It's added to other foods. It's available as a dietary supplement, one of the most commonly used dietary supplements. But vitamin E is a collective name for a group of fat-soluble compounds. These compounds have distinctive antioxidant activities. There are at least 8 different forms of vitamin E. There's the alpha, beta, gamma, delta form. It comes either tocopherol or tocotrienol. Each of those has variable levels of biologic activity, but the body's only interested in the alpha tocopherol. We absorb the vitamin E from the small intestine, goes to the liver. The liver preferentially resecretes only the alpha tocopherol form. It does that by a transfer protein. The liver is going to metabolize the other forms and it's going to kick them out of the body. So the highest level in the body is the alpha tocopherol. Now the absorption process requires some bile acids and some pancreatic enzymes for the absorption and the uptake. And it seems that the packaging of the vitamin E is going to be along with other dietary fats. That's why it's fat-soluble vitamin, so it's put in with the chylomicrons, which basically means that the higher level of lipids in your bloodstream, the higher level of vitamin E you're going to have. Now, vitamin E is a fat-soluble antioxidant, and it's the alpha tocopherol in unfortified foods, the natural form of vitamin E. That's the most important. Now, the supplements, some of them are from entirely natural sources. They also can be alpha tocopherol, but there's often a lot of synthetic alpha tocopherol, and that carries all of the other isoforms, the stereoisomers of vitamin E that the body really doesn't want. So we have actually the highest concentration is going to be of gamma tocopherol. That's the most common form of vitamin E in the diet. But the plasma and the tissue levels of the gamma tocopherol actually are going to be lower than the alpha tocopherol because the gamma tocopherol is going to be excreted. And the body only saves the alpha tocopherol. Are any of the tocotrienols very important? As far as we know, the answer is no. What's the difference between the tocopherol and the tocotrienols? Well, it has to do with unsaturated side chains and some methyl groups that are added. So what's the function of vitamin E? It's an antioxidant. It maintains the integrity of the cell membranes, and it protects the lipid layers, influences the activity of the membrane protein and some of the enzymes, and it protects the fats in the LDL. That's the bad cholesterol, protects them from oxidation because oxidized LDL is especially harmful and leads to atherosclerosis. It also neutralizes free radicals. As it neutralizes free radicals, the vitamin E becomes oxidized and it's regenerated with vitamin C. Now, the antioxidants also protect from damaging effects of the free radicals. Free radicals damage cells, damage the DNA. They can lead to an increased incidence of cardiovascular disease and cancer. These molecules have unshared electrons, so they're highly reactive. They're reactive oxygen species. But whether they're actually important or not, and whether vitamin E really has a role in the way the body handles them, is the subject of major controversy. Vitamin E also is supposed to have something to do with your immune function and cell signaling and gene expression, and also has something to do with metabolic processes. It's an inhibitor of the activity of a chemical known as protein kinase C that's involved in cancer and cell proliferation. Well, it also seems to help maintain the integrity of the endothelial cells. Those are the cells that line the blood vessels, line the arteries. And as a result, it seems that it theoretically might prevent some of the other cells, like the platelets, from adhering to the cell wall of the arteries. And that might reduce the incidence of atherosclerosis. Also seems to boost the expression of a couple enzymes that are involved in arachidonic acid metabolism. Arachidonic acid metabolism, that's why you take the aspirin. Well, the reason you take the aspirin is because it helps dilate the blood vessels and inhibit the platelet aggregation, and maybe vitamin E does the same thing. So we have the dietary reference intake. That's the Food and Nutrition Board of the Institute of Medicine. Now it's the National Academies of Sciences. And what they do is they look for the recommended dietary allowance. That's the average daily intake sufficient to meet the nutrient needs, the nutrient requirements of about 98% of healthy individuals. Well, that's important, but unfortunately we don't have that for vitamin E. We go by the adequate intake. That's a level of intake that's assumed to be sufficient to give you nutritional adequacy. Then we also have the estimated average requirement. That's the requirement that would keep about 50% of the patients, 50% of the people healthy. Now, it's important to realize that the label on the vitamin E has recently undergone change. It used to be international units, but now starting in January of 2020, companies have to report the vitamin E content in milligrams, but if it's a small company with less than $10 million a year in sales, they can wait to change from international units to milligrams up until July of 2021. Now, to convert milligrams to international units, 1 milligram of alpha tocopherol is about 1.5 international units of the natural form. Synthetic form, it's about 2.2 units, international units. So the question is, how do they arrive at these numbers? And is there really any significance in the number? And unfortunately, all of the data that they've collected has great uncertainties because it's done on test tubes, in the test tube. And what they did is they fed men a vitamin E deficient diet, and they looked to see how fast the red blood cells broke down if you added a little hydrogen peroxide. Now that was considered an important in vitro, in other words, test tube assay. But what happens is the RDA is not based on health promotion or the prevention of chronic disease. So we don't know that any of the numbers that are put out by the government really, in this regard, mean anything. But it's suggested that in those adults 14 years of age and older, 15 milligrams is the adequate intake, since there is no established RDA, for vitamin E. Pregnant and lactating women should probably take a little bit more, about 19 milligrams. Now, the intake from food, on average, is only about 7.5 milligrams. That's well below the suggested adequate intake of 15 milligrams. You can get the sufficient amount of vitamin E by diet alone. You have to eat a lot of nuts and fruits and seeds and vegetables. But there's a word of caution now because everybody is so worried about the amount of fat in the diet. People are in these low-fat diets. Well, low-fat diets are going to produce a lower level of vitamin E. Well, the foods that have a lot of vitamin E, if you have 1 ounce of either almonds or peanuts, that has 7 milligrams of vitamin E, so you're getting close, you're getting 50%. Hazelnuts only have about 4 milligrams. If you have some wheat germ oil, a tablespoon of that, you get about 20 milligrams. That's well in excess of the adequate intake. Substance like broccoli, that's good for a lot of purposes, only has about 1 to 1.2 milligrams in a cup. That's only about 8% of your adequate intake. So you look at the fortified breakfast cereals with vitamin E. Well, they're mostly gamma tocopherol. Body doesn't care too much about gamma tocopherol. That's from soybeans and canola and corn oil and some other vegetable oils. So what's the basic source of vitamin E in our diets? Well, it's seafood and lean meat and poultry and eggs and mayonnaise and the beans and peas and avocado and asparagus and spinach. That gives us our vitamin E. Now, it's estimated that here in the United States, about 1 person in 9 takes supplements of vitamin E. The supplements of vitamin E typically contain in excess of, or at least 400 international units. And that's perhaps important because about 90% of us don't meet the adequate intake. Now, if you look at vitamin E only supplements, so just vitamin E, if you took 67 milligrams, that's about 100 international units of vitamin E, that's going to be higher than the RDA. So by taking any of these supplements, you're going to boost your level of vitamin E in excess of what is the minimum amount. Now, there is a maximum amount. We'll talk about that in a moment. Now, if you get some of these supplements, some of these fortified supplements, you find that the vitamin E is esterified, so it's chemically put together with something to give it a longer shelf life. The body easily hydrolyzes the form into the natural element. Now, if you have a problem with digesting fats or fat malabsorption, you could theoretically have a decreased level of vitamin E, but frank deficiencies are pretty rare. Marginal intake is quite common, but overt deficiency, well, we don't see that in even people who have a little bit of vitamin E. The only group where low levels of vitamin E seem to be very important are in the preemies who weigh less than 2,500 grams. They can be deficient in vitamin E, and if they don't get enough supplement of vitamin E, they could develop an eye problem we call a retinopathy. But if they get too much vitamin E, that can lead to infections. Now, there's some rare diseases that are associated with low levels of vitamin E and some poor neural transmission, muscle weakness, retinal degeneration that can lead to blindness. Those are very rare. Ataxia, difficulty walking, nerve damage, impaired balance, impaired coordination, peripheral neuropathy. Again, only extraordinarily rare and with specific disorders, not the kind of thing you see if you don't get enough vitamin E by your diet. Now, vitamin E has a lot of health-related claims. It's supposed to prevent disease and to treat disease. It's supposed to do this because it's an antioxidant or anti-inflammatory. It inhibits platelet aggregation. Supposedly, it enhances the immune system. Now, none of those have been shown in people. And certainly, it hasn't been shown that vitamin E is important, at least as far as the supplements are concerned. So for health purposes, let's talk about coronary heart disease. So does it help prevent or delay the onset of coronary heart disease? Well, in vitro, in those studies in the test tube that I mentioned, we know that we can inhibit the oxidation of bad cholesterol. And oxidized bad cholesterol, that's extra bad. That's the active form. That's the nasty form of the bad cholesterol. And it's thought that vitamin E might prevent the formation of blood clots, so that's obviously important because that could reduce the incidence of heart attacks and deep vein thromboses. So they did some studies, observational studies. Observational studies don't give us really reliable information. It was from observational studies that we used to tell women to take hormone replacement therapy, and then we had some randomized controlled trials, and we said, oh my goodness, don't take them because it seems that the estrogen does more harm. Well, the same thing happened here with vitamin E studies. The observational studies, well, it showed that there was about a 30 or a 40% reduction in the incidence of heart disease. And that obviously is nothing to sneeze at. However, then we have the randomized controlled studies, and they cast doubt on the value of the supplements for heart disease. So the HOPE study, the Heart Outcomes Prevention Evaluation Study, lasted about 4.5 years, looked at 10,000 individuals. These individuals were at risk for heart disease, heart attack, stroke. They took 268 milligrams of vitamin E a day. That's 400 international units. And actually, there was no difference in the cardiovascular events or the hospitalization for heart failure or chest pain compared to placebo. So it didn't seem to help. Then they did the Heart 2 study. That was a follow-up of 4,000 of those individuals who were in the original study. They followed them for 2.5 years longer, and they found no decrease in the heart attacks or stroke or unstable angina, no decrease in the incidence of death from heart disease, or even no all-cause mortality-related death decrease. Didn't find any of that, but what they did find is about a 20% increase in the risk of hospitalization for heart failure. So no decrease in heart disease, but an increase in the risk of needing hospitalization. In Framingham, long-running study, they did basically the same thing, and they found no statistically significant association with vitamin E and either all-cause mortality or cardiovascular mortality, even going out as far as 10 years. But they did find an increased incidence of hemorrhage and an increased incidence of heart failure. They actually found that the more vitamin E you take, the greater your risk. Then they did something known as the Women's Angiographic Vitamin and Estrogen Study, looked at a significant number of women. These were postmenopausal women. They had some degree of coronary stenosis. And what they found again was that the supplements of vitamin E, no cardiovascular benefit, but again, there was an increase in the incidence of all-cause mortality, increased incidence of death from all causes in people taking vitamin E versus no vitamin E. And the latest trial looked at 40,000 healthy women over age 45, 10-year follow-up. No change in the cardiovascular event, no change in non-fatal heart attacks, stroke, cardiovascular death, all-cause mortality. They actually did another study, looked at 15,000 healthy physicians over age 50. They gave them some vitamin E, and they gave them some other vitamins. And what did they find? Again, after 8 years, no significant benefit, no change in the incidence of heart disease or heart-related death, but an increased incidence of stroke, ischemic stroke. So the evidence so far shows that in spite of all this talk about how good vitamin E is for your heart, how good it is as an antioxidant, how it boosts your immune function and helps your blood, no evidence that it does. Cancer, antioxidant vitamin. It's supposed to protect the cells from damage from the free radicals. Well, if we don't have enough, it might lead to too many free radicals, and that could lead to cancer. Vitamin E is supposed to block the formation of carcinogens in the gut, so it takes the form of a blockage from nitrites to nitrosamines. Boosts immune function. Well, what about the incidence of cancer in people taking vitamin E? HOPE-2 study, 7-year follow-up study, no significant change in the incidence of cancer, cancer-related death, women's health study, no decrease in cancer from any form. They did a prostate study, and what they found was that there was no association with the dietary or with the supplements of vitamin E, except maybe in people who were either current or former cigarette smokers. Then if they take the vitamin E, they might reduce the incidence of advanced prostate cancer, only advanced prostate cancer. But then what they did is they did another study called the SELECT trial, 7 to 12-year follow-up. They gave the people daily synthetic vitamin E, 400 international units, gave them some selenium, stopped the study early because they didn't find any benefit. No prevention of the prostate cancer. Also, the studies have shown no decrease in the incidence of lung cancer, no decrease in colonic cancer, colorectal cancer, no decrease in all cancers combined. Then we have the prospective cohort study looking at about 88,000 people in the National Health Service, looked at 47,000 men in the Health Professionals Follow-Up Study. The incidence of cancer, vitamin E didn't help. So to date, we don't have any evidence that vitamin E is going to provide any significant benefit. Then they looked at the eye. And there's some evidence that it might help prevent acute macular degeneration if you already have early macular degeneration. But for the general population, don't have any evidence that it's going to offer any kind of protection. And as a matter of fact, it might not be the standard AREDs that most people are taking. Most people take the vitamin supplement that contains a little bit of zinc and beta-carotene, now out, or maybe some vitamin C and some copper. But it seems in those studies, the antioxidants alone don't prevent advanced AMD. Well, what about cataracts? No benefit as far as cataracts are concerned. Cognitive benefit? If you take the vitamin E, we know that the brain requires high level of oxygen consumption, so that means it's going to make a lot of free radicals, and we have all those polyunsaturated fatty acids that can be altered in the membranes. So it would be a good idea, most people would assume, to have the antioxidants present. But what about the cognitive decline? Does it really help? Well, the prospective studies in free-living individuals between 65 and 102 years of age, primarily in healthy older women, show that significant levels of intake of vitamin E like 600 international units. No significant benefit. Looking at men and women who have mild cognitive impairment, no difference from placebo on follow-up. So it doesn't seem to help the brain either. Well, originally they thought it might help prevent the non-alcoholic fatty liver disease. Current evidence, nope, doesn't do that. Now, do you get some side effects from taking vitamin E? Well, if we're talking about the natural vitamin E in food, no side effect whatsoever. If we're talking vitamin E supplement, well, if you take an increased dose, you might have some hemorrhage because of a decrease in the platelet aggregation. Platelets are those little formed elements that are important in the clotting process. So it seems to interrupt the clotting process. Human studies, well, if you get too much of the vitamin E, too much could be 400 international units a day, well, that has a tendency to cause bleeding. So it's been suggested that you stop taking supplements of vitamin E at least 2 weeks before you have some kind of surgery. If you take the supplements, you could rarely have some side effects like nausea or diarrhea or intestinal cramps or fatigue or weakness. But those are extraordinarily rare. So what is the maximal uptake, maximal amount that you should consume? Well, the Food and Nutrition Board, the board of the government, they say vitamin E seems to be safe at a dose of up to 1,000 milligrams a day. Says you probably shouldn't take more. The evidence, however, is really limited. Now, we do know that potentially it might interfere with the clotting mechanism. So that's why we have to worry a little bit about taking too much. Because remember, the death rate, the all-cause mortality rate, even at a dose of 400 international units, has been shown to be increased. Now, another thing, if you're taking vitamin E, especially 400 international units or more, you have to be careful of other things that might make you bleed. So for instance, taking aspirin or anticoagulants or antiplatelet drugs like warfarin, those might thin the blood a little bit too much. And there are certain medicines you shouldn't take with vitamin E, so if you're taking radiation therapy or you're taking chemotherapy, probably not a good idea to take vitamin E. We also know that you can have lower levels of vitamin E because of decreased absorption if you're taking mineral oil or Olestra or sulcrophate or certain of the cholesterol-lowering medicines, not the typical medicines that we use like the Lipitor, but more drugs like cholestyramine or cholestipol. And we know that people who are taking Dilantin and Tegretol can have reduced amounts of vitamin E. And if you have a history of hemorrhagic stroke, liver failure, peptic ulcer disease, probably not a good idea. Hemophilia, absolutely not. Don't take any extra vitamin E. What about immune function? Immune function supposedly is going to be boosted by taking vitamin E. But again, we don't have any evidence that it's going to be of any value to anybody. So a lot of people taking vitamin E, a lot of stories about how great vitamin E is for you, a lot of stories about, oh, I took vitamin E and I feel like I have so much more vigor and I don't have this and I don't have that kind of disease. No evidence for any of that. So that's the story with vitamin E. The evidence just isn't there that supplements of vitamin E are going to benefit anyone, but we do know that we can possibly increase your all-cause mortality, increase some other significant medical problems if you take too much vitamin E. So if you want to guard your health, still the best options, good diet, regular exercise, keep your weight under control, avoid alcohol, stay away from cigarettes, minimize your stress. And if you do that, then you got everything going for you. Then it's the genes and other things that are going to determine your lifespan. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau. you.